Okay, so sometime in your exam you may get question about what do you mean by vital statistics, or sometime what do you mean by health indicators. Okay, so both things are same. Okay, so what is statistics or what is indicator? Any idea? Have you heard this word, vital statistics? Especially when we provide services in the community, we should know about the statistics or health statistics, vital statistics or health indicator. All are same. Okay. As the name suggests, indicator means it is something which tells us about something. It indicates us about the level of our health or level of our community's health. So this is known as health indicator, or in other words we can say that health indicator are quantifiable characteristic of a population which researchers use as supporting evidence for describing the health of population. Okay, it is defined like this, that it is quantifiable characteristic, means where we can show some data about that particular event from the community or population, then it is known as what? Health indicator. Okay. For example, when we do our survey in the community, in our area, what we find out? First of all, total number of population living in our area. Okay, so that is one indicator or statistics or data. Okay, in the same way, during these survey we also find out the number of eligible couple in the community. So that is also a data or information, and these also shows the indicator sometimes. Okay, so these data are also known as vital statistics. Okay, sometimes we use these as vital statistics and sometimes we say it is health indicator. To finalize or formulate these statistics, the information is collected from population. Okay, by means of survey. हम लोग सर्वे करेंगे तभी तो हमें इंफॉर्मेशन मिलेगी, ठीक है ना. होम विजिट करेंगे, वहाँ से पता लगाएंगे. And when we collect these data are informed to our higher authorities, where they analyze our data and finally they prepare our health indicators or health statistics of the particular population or particular community. Okay. The health indicators are often used by the governments to prepare healthcare policy. Okay. Normally these data are utilized or for useful for the higher authorities, because based on these data they can prepare health policies for their particular district, for a particular state or for the country, depending upon these vital statistics. Okay. The health indicator not only used to measure the health status of the community, but also by these data we can compare the health status of one community from the another. Okay, if we have data of for example utilization rate of family planning methods from in one community, and then we can compare data of both two communities, that how effective the service is in the community A and how effective service is in the community B, depending upon the data of utilization of family planning methods. Okay, if community is using more family planning method, it means they are aware about the population stabilization. Okay, in the same way, if we are using the data of immunization coverage of two communities or two villages, then we can compare. If the one community is having 90% immunization coverage and one community has only 60% immunization coverage, then these the services can be compared. In one community we are not able to provide better services because the immunization coverage is not good. Okay. So अब जो हमारे पास डेटा है उसका क्या फ़ायदा है इन इंडिकेटर्स का? एक तो वी कैन प्रिपेयर आवर पॉलिसीज और प्लानिंग फॉर द कम्युनिटी, एंड सेकंड दूसरा क्या होगा, वी कैन कंपेयर द हेल्थ स्टेटस ऑफ वन कम्युनिटी विद द अनदर. ठीक है ना, ये दो बेसिक हमारे बेनिफिट होंगे वाइटल स्टैटिस्टिक्स के. क्लियर? ओके. अब ये जो वाइटल स्टैटिस्टिक्स हैं इनसे हम नीड असेसमेंट भी कर सकते हैं. ठीक है ना, कम्युनिटी नीड असेसमेंट वर्ड आपने सुना होगा ना. तो नीड असेसमेंट भी कहाँ से होगी? जब हमारे पास वाइटल स्टैटिस्टिक्स होंगे या हेल्थ इंडिकेटर होंगे. तो कौन सी कम्युनिटी को किस टाइप की सर्विसेज ज़्यादा चाहिए वो उसी को हम क्या कहते हैं, कम्युनिटी नीड. तो हमें पता लग जाएगी डिपेंडिंग अपॉन द वाइटल स्टैटिस्टिक्स विच वी हैव कलेक्टेड. जैसे अभी हमने एक एग्जांपल लिया था कि इन वन कम्युनिटी द इम्यूनाइजेशन कवरेज इज 60% एंड इन वन कम्युनिटी इट इज 90%. सो विच कम्युनिटी नीड मोर immunization services which is having less immunization coverage? For them we can ask to plan outreach services, outreach health camps for the immunization. Okay, and we can send more manpower to there to that area. So these data or vital statistics are also utilized for defining the need of the community of the country. Okay, so this is just introduction what is health indicator or health statistics are. Now we should know the main health indicator. So main health indicators are the mortality indicators which shows about the rates of deaths, then morbidity indicators which shows the rates related to diseases, nutritional status indicators, healthcare delivery indicators, utilization rate indicators, social and mental health indicators, environmental indicators and other indicators. Okay, so under these headings we will discuss this topic. Okay, if you are able to remember the headings you can write your answer very easily. Okay, so these 8 points are there in the indicator. So we have so much health indicators. So now we can discuss them one by one. First one is mortality indicator. Okay, means the indicators related to deaths. So mortality indicator include the death rates, death related rates such as crude death rate. Example क्या है? Crude death rate. So what is crude death rate? Crude death rate means any death in the community is known as crude death rate. It is defined as the number of death per 1000 population per year in the given community. Okay, for example in our area, that is our community under a sub-center or PHC. So in that community how many deaths occur in the whole year, and then we divide it with the total population and multiply by how much? 1000. Then our crude death rate will come, and it is always shown as the number of death per 1000 population of a community. In this way we can find out the death rate of our community as well as the whole country if we are able to know the total deaths and the total population. ठीक है ना, अगर ये दो चीज़ें हमें पता है तो हम उसका डेथ रेट निकाल सकते हैं. तो नॉर्मली जो डेथ रेट निकालते हैं दैट इज नोन एज क्रूड डेथ रेट. ठीक है ना, उसका जो सही नेम होता है वो है CDR या क्रूड डेथ रेट. ओके, नाउ अपार्ट फ्रॉम क्रूड डेथ रेट वी हैव सम अदर रेट्स, डेथ रिलेटेड रेट्स सच एज एज स्पेसिफिक डेथ रेट्स. ओके, व्हेन we clearly indicate the death of a particular aged person, then it is known as age related death rates. Example, इसका एग्जाम्पल क्या ले सकते हैं? बेस्ट हम ले सकते हैं infant mortality rate. Okay, so infant mortality rate is also a death related rate, but it shows or indicate the specific age group. Okay. So infant का age group क्या होगा? What is the age group of infant? From birth up to 1 year of age, है ना? तो 1 year एज तक के जो बच्चों की जो डेथ होगी, that will be included in the infant mortality rate. Okay. So infant mortality rate is the ratio of deaths under 1 year of the age in the given year. पूरे साल में कितनी डेथ हुई है 1 साल तक के बच्चों की, to the total number of live birth in the same year, and it is expressed as per 1000 live birth. ठीक है. तो इसका मतलब क्या हुआ? इसको हम कैसे निकालेंगे? इसको हम टोटल पॉपुलेशन से नहीं निकालेंगे, है ना. एक्चुअली जो CDR इज कैलकुलेटेड एज पर टोटल पॉपुलेशन, बट इन्फेंट मोर्टेलिटी रेट इज कैलकुलेटेड एज पर द नंबर ऑफ लाइव बर्थ, हाउ मेनी बर्थ took place in our area. Okay, as per these data we calculate the infant mortality rate. Okay, then there is one another rate that is mortality indicator, that is child mortality rate. Okay, so again it is age specific rate, and in child mortality rate we calculate the death of children up to 1 to 4 year. Okay, infant it is up to 1 year, and then 1 to 4 year it is child mortality rate. Okay, then one more specific death rate is there, maternal mortality rate. Okay, so what is maternal mortality rate? Means when we calculate the death of pregnant ladies, okay, or the death which is related to pregnancy even after delivery. Okay, but it is, if it is due to the complication related to pregnancy, then it is known as maternal mortality. Okay, so maternal mortality account for the greatest proportion of death among the women in reproductive age in most of the developing world, especially जो developing countries हैं उनमें MMR या maternal mortality rate काफ़ी हाई होती है ना, due to many factors, but it should be less, or even it should be zero. If we are able to provide best antenatal services, then it should be zero, but it is not zero na, in our country, or especially all the developing countries, they still have higher maternal mortality rates. Then another type of indicator, mortality rate indicator, is disease specific mortality indicator. So these what is the disease specific? Means when we calculate the death rates due to a particular disease, then it is known as disease specific death rate. What is the example of disease specific death rate? Can you explain? If we want to calculate disease specific death rate, then how we will express? For example, how many deaths occur due to tuberculosis in your area, then it will be disease specific death rate. In the same way, how many infants died due to diarrhea, then it is disease specific death rate. Okay, so in this way these indicators are calculated. So these all indicators which we have studied till now, they were mortality related or mortality indicators. Now we come to the morbidity indicators. Okay, what is the meaning of morbidity? Morbidity means related to disease or morbid condition. Okay, morbid condition means disease. So here morbidity indicators are the rates or which are related to a disease or disorder. Okay, and what are those rates or these ratios? Basically we have three types of morbidity indicators. Okay. These are incidence rate, prevalence rate and notification rate. Okay, incidence rate, prevalence rate and notification rate. So what is the meaning of incidence rate? First of all, we will discuss incidence rate. Anyone can explain what is incidence rate? New cases, है ना? Okay, very good. So all the new cases of a particular area or particular disease is considered as incidence rate. Okay, and this incidence rate is defined in particular area or community during a given period of time, and this period of time may be one day, even 1 week, or even 1 month, or even 1 year. So it is given. So in that particular time, what is the incidence rate of a particular disease? Okay, and this you can find easily by your survey or by your reports. Okay. If we take example, again we can take example of tuberculosis in your area. If in 1 month in your sub-center or PHC area you are finding that 5 new tuberculosis cases they have appeared, then the incidence rate of this month will be 5. Okay, tuberculosis patient. And second thing is prevalence rate. Okay, prevalence. So what is the meaning of prevalence? Prevalence is both cases. Okay, both cases. The new cases appeared in during the particular period and plus old cases which are there in the community. Maybe they are undergoing treatment or may not be. Okay. So both cases calculated combinedly, then it is known as incidence rate. So in the same example, if we know that in previous month there were 3 cases of tuberculosis and we have started treatment in our area, and now this month 5 cases appeared. So total prevalence rate of this month will be how much? 3 and 5, total 8 cases. Okay, but still if we remember while calculation that 1 patient died during the treatment in this month, okay, on 3 or 4 date, 3rd or 4th, then that will be striked out. Okay, so the prevalence rate of this month will be 7. Okay, so at particular time how many total patients are there, this is known as prevalence rate. Okay, and then third one is notification rate. So what is the notification rate? So notification is specially for the communicable diseases, and a notifiable disease is it depends upon the higher authority, and it varies between area to area. Okay, for the national level there may be some diseases, there is a list that these diseases are notifiable, and mostly these are notifiable in whole country and sometimes area to area. For example, tuberculosis. Tuberculosis is a notifiable disease. Whenever any doctor come across or even health personnel come across a new patient of tuberculosis, he need to notify the disease to higher authority. Okay, this is notifiable disease. In the same way, if there is COVID case, it is again notifiable. Measles in the children, it is again notifiable. But if there is diarrhea, then it is no need to notify. No? So there are some notifiable disease, and how many diseases are notified to the higher authority, this is known as notification rate. If notification rate of a particular disease is high, then we can understand the problem is there in the community. If the notification rate is less, it means the disease is not spreading. Okay, so notification rate, incidence rate and prevalence rate, these are basically morbidity indicators. Okay, they tell us about the disease, it is spreading or not. Apart from these are the main 3 indicators. Apart from this, there are some other indicators which we may include in the morbidity indicators, like OPD attendance rate. So how many patients are coming in the OPD. If they are more, then there is problem in the community. If OPD attendance rate is less, then the community is healthy. Okay. In the same way, admission, readmission and discharge rate. Okay, we also calculate them in the hospital, how they are admitted and number of cases. And then duration of stay. How many days a particular patient of having a particular disease is staying in the hospital. This is also a morbidity indicator. And then spells of sickness. Spell of sickness means in whole year, a particular person is suffering from a particular disease, how much time? For example, if a child is there in the community and he is suffering from diarrhea 3 times in the whole year, then the spell of sickness will be 3 for that particular person. Okay. So these are also the morbidity indicators. Okay. So about them we can just write their name. It is okay. Okay. Then third one is nutritional status indicators. So what are the nutritional status indicators? These indicators will show the nutritional status of a particular person. These includes anthropometric measurements of preschool children like birth weight, height or the weight, normal weight, mid-arm circumference, chest circumference of children. Okay. So through these measurements we can find out the nutritional status of the child. So these are nutritional status indicators. Prevalence of birth weight. Okay, if the birth weight is less than 2.5 kg in the community, in the children, so it will be a problematic situation. It means they are low birth weight babies. So through these indicators we can find out the nutritional status of the community. If low birth weight are more, children are more, it means the antenatal mothers, they are not consuming the proper diet. Okay. So these are the nutritional status indicator. Then there are some other indicators which are known as health care delivery indicators. Health care delivery indicator means how we are providing services to the community. Okay, for a particular state or country. These main healthcare delivery indicators are doctor population ratio. Okay, if doctor population ratio is more, then the services will be better. If it is less, then problematic situation. Doctors nurse ratio, population bed ratio means in the hospital how many beds are available for particular population. Population per health sub center. Okay, ideally one health sub center should cater how much population? 3 to 5,000 population, but in our country this one sub center normally caters 10,000 or sometimes even 15,000. So how much population that particular center is covering, this also shows the healthcare delivery indicator. And the population per traditional birth attendant. Okay, so how many birth attendants are there? DAIs or ASHA or trained birth attendant or ANMs, how many they are available in the community, this also shows the healthcare delivery indicators. Okay, so here you can just write the names, it is sufficient. Then we come to utilization rate indicator. Okay, what is the utilization rate indicator? It means the health services are available in the community, but the population is not aware about them and they are not utilizing properly. Okay. For example, normally in all the sub centers we have sufficient number of vaccines, but the beneficiaries are not coming or they are not taking the advantage of that facility. That's why we are not able to cover the immunization 100%. Okay. And in the same way we are having sufficient number of family planning methods, but community is not using. So these are known as utilization ratio, how the people are utilizing the health services from the health centers. So proportion of infants who are fully immunized against communicable disease, this indicator is also known as utilization rate indicator. Proportion of pregnant women who receive antenatal care, how many mothers are receiving antenatal care, sometimes even they are not registered. Okay, they are not getting at least 3 antenatal visits they are not getting sometime iron folic acid tablets. So these number or these data also include in the utilization rate indicators. Then percentage of population which are using the various family planning methods, bed occupancy rate in the hospital. If beds are lying vacant, then two things may be there. If the community is fully healthy or community is not healthy but they are not aware about the facility available in the hospitals. Okay. Then average length of stay in the hospital, bed turnover ratio means how many patients are admitted and how many discharged after taking treatment. So these indicators are known as the utilization ratio. Then there are some social and mental health indicators, okay, in the community, through which we can find out the actual how the people are suffering from the mental or social problems, which finally may affect their physical health as well. Okay, these data includes social crime rate. If the crime rate is more in the community, it may affect overall health of the population. Okay, if the social crime rate is less, people will be happy and healthy. Okay. Apart from this, homicide rates. What is the meaning of homicide? These are two words, homicide and suicide. Suicide means killing self and homicide means killing another person. Okay. If it is more, then again it will affect the health. Other crimes, violence such as road traffic accidents, juvenile delinquency, alcohol or drug abuse, smoking, consumption of tranquilizers, obesity, these are known as social and mental health indicators. If number are more, then they affect the health negatively. If the rate is less, then it will affect the health positively. So these indicators are considered as social and mental health indicators. And then finally, we also have some environmental indicators which also affect our health. And best environmental indicator nowadays we are aware about AQI. AQI is Delhi is very in severe stage sometimes and very poor stage, which shows that our health is at risk. Okay. Then indicate related to water pollution, indicate related to noise pollution, how much decibel is there, the noise pollution. Okay. So these data are known as the environmental indicators which affect our health. Okay. So this is all about the indicators of health or health statistics. Okay. So you can write your answer, you can write your